Well, this is October and it's Breast Cancer Awareness Month, so I'd really like to talk to you guys about some of the statistics about breast cancer and why early detection is so important. Because you were saying 1 in 8 women are diagnosed?
And with everything we know about breast cancer today, Amy, we still in the medical community don't know how to prevent it. And so early detection becomes paramount to the survival of the woman. And it's much easier to treat a breast cancer when it's small and non-invasive than when it is at a more advanced stage. So we hammer away at women to please do have a clinical breast exam every year, do their monthly breast health exams, and to have a mammogram every year beginning at age 40.
So people do need to know these things and talk to their doctors about them, because cancer, I think when people hear that, they think, oh, it's a death sentence. But it doesn't have to be that way
Breast
anymore.
cancer is actually one of the most treatable cancers that there are. And when we talk about cancer, it's not one disease. It's basically a cluster of about 300 different diseases. There are different types of breast cancer, Amy, and women need to know that. It's not all one of a kind. And so again, early detection becomes key to the survival of that woman, but it's really one of the most treatable breast cancers that there are. And when detected in early stages, the 5-year survival rate is anywhere between 97 and 98%.
How do I get the van to come out?
It is very easy, and it's something that Lexington Medical Center is proud to be able to offer to our community. Actually, the phone number is posted on the side of our mammography unit at 791-2486, and we ask you just to give us a call, and we try to find it to be very accommodating to the businesses throughout our community in a fashion that we want to extend this mammography exam to the ladies of our community. We realize that their time is getting tighter and tighter as they're raising children and families and being those soccer moms. They only have a certain amount of time for these exams. Lexington Medical Center is happy to bring it right there to the business they work in.
Well, because then you can't procrastinate either. But Deidre, do I need to get a doctor's slip to come in?
If a woman is having a screening mammogram, that is simply her yearly mammogram, and she has not detected any problem with her breast health, then she can self-refer for that. If the woman has a lump or a change in her breast tissue and is concerned that perhaps she might have breast cancer, that becomes a diagnostic mammogram, and we encourage her to call our breast health specialist, and that's 791-2521, and we will assist her in getting a clinical breast exam, getting the order in, and getting her in within 24 hours to begin the diagnostic process.
Do we set up an appointment? Does the business do that? How does this work?
Well, you can call our scheduler and set up a site visit for us to come to your facility, business, whatever, and we will either schedule the mobile at your convenience, and then we let you choose the way you want the patients to get scheduled, and then we work that process, and then we come out on the day, and then you send your employees out. It takes about 10 minutes away from their job, like a coffee break, and they're right back to work.
I can't imagine that anyone would want anything but the best for their staff, their associates, their employees, as well as to encourage those around them to take advantage of what Lexington Med has available here. It's just, as Tim and I talked, two things happen. On rare occasion, when it's recommended that they may have a problem, that's an early detection, of course, as the very best it can get. The other side of it is, if they don't see a problem and everything seems great, I don't know anything more wonderful than going home to your family and feeling good, and they're feeling good. I mean, what a life changer.
Right here, as we are right now in front of Wray Automotive setup, it's just that easy. It takes us about 10 minutes to get set up. But we want to be accommodating to your schedule. If you have a small business and you think, well, 5 or 10 people may not be enough, it is enough. One person is enough for us to be able to help, but you can always invite your neighbors and have your co-workers invite their friends as well.
We do file insurance, and most insurances do pay for 1 mammogram a year, and also we take Visa, MasterCard, and Discover card.
We are able to offer a woman who has limited financial means and meets certain financial criteria a screening mammogram free of charge this year. So we're very excited about that.
So again, ladies, there's no reason not to do it, because we're making it convenient, and we'll find a way to get it paid for, hopefully.
We'll make sure you get your mammogram.
And as a business, it makes sense to you because of time off.
I have to hastily add, I don't know of any business that the health expense isn't on the front burner now, and will be for some time. And when the key nationally, locally, as a business person, the key, of course, is long-range the long-range battle against expenses when you can spend $220 or $30 here versus the expense of undetected until much
Until it's
later
much
than
later
you
date.
wish. That's right.
A woman can call us at the hospital and make us aware of the fact that she has detected an abnormality in her breast tissue, a lump or a change, and at that point the clock begins ticking for us. And we promise a woman a definitive diagnosis, being able to tell her whether or not it's benign or malignant within 5 working days or less. We average our statistics monthly and report those into administration. We track those and we take great pride in those. And they're currently running 1.6 days for detection to diagnosis.
Which is so huge
Right. It's
because
unheard of.
as a woman you worry, and there's the worry is almost worse than having
We
to go in.
recognize that. We recognize that there were women who were waiting out in the community, sometimes languishing for weeks, trying to get a physician's appointment and then
Yes.
trying to get in to be scheduled for a mammogram. And we recognize that if we gave that woman a nurse navigator and assisted her, that we could speed that process up dramatically.
We're taking it from the point of view of the patient. You take it from the point of view of the patient, and many other things just kind of fall in place then. And the patient needs here are certainly that they want to know, do they begin this fight?
Yeah.
And when do they begin this fight? And we try to get that information to them as quickly as we possibly
certainly
can,
do.
as compassionately as we possibly can, and with a nurse navigator and others to be able to just team up with them and begin that fight.